Welcome back to the deep dive. Okay, today we're tackling mesenteric adenitis using these pediatric revision notes. Our goal, really, is just to sift through and pull out the absolute must-know stuff for you. Make revision a bit easier, hopefully clearer.
Exactly. Think of it as the high-yield distillation. Straight to the essentials for revision.
Perfect.
Mm.
So let's dive right in. First up, what actually is mesenteric adenitis?
Okay, so fundamentally it's inflammation, specifically inflammation of the lymph nodes, the ones in the mesentery.
The mesentery, that's the tissue holding the bowel in place, right?
That's the one. And the notes really highlight this. It's most common in kids, typically under 15.
Right, so think pediatrics straight away. Got it.
Yeah.
Lymph node inflammation, what causes it? Where does it come from?
Well, it's usually an infection kicking things off. Most often it's viral.
Okay.
But, sometimes it can be bacterial. It's often linked to another infection that's just happened or is still going on.
Well, like what kind of infection?
Things like respiratory infections, colds, sore throats, or sometimes gastrointestinal bugs. So a child with tummy pain who, say, had a cough last week, that's a clue.
Ah, okay, so the lymph nodes are reacting to something else happening nearby. Makes sense. Who's most at risk then?
Well, like we said, children and young adults are the main group. Obviously, being exposed to these common infections increases the risk.
Naturally.
And as you probably guess, individuals with a weakened immune system might be more susceptible too.
So how does that work? An infection somewhere else triggers this inflammation in the belly.
Yeah, it's about the body's response. An infection, maybe in the throat or the gut, activates those nearby mesenteric lymph nodes as part of the immune system doing its job.
Okay.
That activation causes them to swell up, become inflamed.
Right, the immune system responding locally. Now, clinical features, this sounds crucial, especially for telling it apart from other things. What are the key symptoms?
The big one is abdominal pain. And here's the really key bit for revision. The notes emphasize it's often in the lower right quadrant.
Okay, hang on. Lower right quadrant pain in a child. That immediately makes you think.
Appendicitis, exactly. That's the classic mimic, the big differential diagnosis we need to consider.
So that right, iliac fossa pain, the RIF pain. What else?
They might have a fever, sometimes nausea or vomiting. You might sometimes feel enlarged lymph nodes, but often they're only picked up on scans.
Okay.
And here's a really useful memory hook from these notes. Look for that link to a recent viral illness.
Ah, like the cold or sore throat you mentioned.
Yep, precisely. Coryusa, sore throat, maybe even an ear infection. You might even find some swollen glands, lymph nodes in the neck, too.
That preceding illness seems like a really important clue. How common is mesenteric adenitis overall?
The notes say it's considered, relatively common, especially in kids. But interestingly, they also mention that the actual prevalence isn't that well documented, certainly here in the UK.
Right. Okay, so you suspect it. Child with RIF pain maybe had a sniffle last week. How do you investigate?
Well, the clinical picture, the story is really key. But you'll want some tests to back it up and, importantly, rule out other causes.
Like appendicitis.
Exactly. So blood tests are standard, full blood count, inflammatory markers like CRP, imaging is really helpful here.
Ultrasound.
Abdominal ultrasound, yes, that's often the first choice. It can actually visualize the enlarged lymph nodes sometimes. And crucially, it can help rule out appendicitis by looking at the appendix itself.
Makes sense. What about CT scans?
CT might be used if things are still unclear after ultrasound, but it's less common, radiation dose in kids. And don't forget the simple bedside tests.
Oh, right. Like
Urine dipstick to rule out a UTI, and a pregnancy test in relevant patients. Standard workup for RAF pain.
Got it. Now, you mentioned a memory hook with investigations, something about the results.
Yes, this is super important. What do the tests typically show in mesenteric adenitis?
Is this the bit where they're often normal?
Bingo.
Yeah.
That's the key takeaway. The blood tests, the CRP, the urine dipstick, they're typically normal.
Wow. Okay.
Which is a massive contrast to appendicitis, where you'd usually expect raised inflammatory markers, maybe a raised white cell count.
So tests often normal. That's a major flag for mesenteric adenitis, not appendicitis.
It's a really strong pointer. Definitely one to lock away for revision.
So given that RAF pain overlap, what are the absolute top differential diagnoses to keep in mind?
Number one, always, 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 appendicitis. You have to rule that out.
Top of the list.
Definitely. But also think about IBD, like Crohn's disease, UTIs, as we mentioned. In girls, ovarian torsion is a possibility. Basically, any serious cause of abdominal pain needs to be on the radar.
Okay. So you've done your checks. Maybe the ultrasound is suggestive. Tests are normal. You think it's mesenteric adenitis. How do you manage it?
Because it's usually viral, the management is primarily supportive. It's about making the child comfortable.
So things like
Good beaming.
paracetamol, ibuprofen, making sure they rest up, plenty of fluid, so hydration, and really importantly, reassurance.
Reassurance. Yeah, for the child and the parents. The pain can be quite significant, so explaining what's going on, that it gets better by itself, is key.
What about antibiotics?
Generally, no. The notes are quite clear on this. Antibiotics aren't usually needed unless you have a strong suspicion or proof of specific bacterial cause, which is pretty rare.
Right, usually viral, so antibiotics won't help.
Right.
And what's the outlook? The prognosis?
Generally, it's excellent. It's almost always self-limiting.
Meaning it just gets better on its own.
Exactly. Usually clears up within a few weeks.
Hmm.
And typically no long-term problems.
Any complications to be aware of, even if rare?
They are rare, but the notes do mention possibilities like an abscess forming or very rarely peritonitis. Good to know they can happen, but emphasize they're uncommon.
Okay, so pulling it all together for revision, key things are young age group, that preceding viral illness history, the RIF pain that looks like appendicitis. But crucially, those investigations, especially bloods, are often normal. That seems to be the big differentiator.
That's a great summary. The real challenge in practice is often making that distinction confidently, especially from appendicitis.
Which leads us to a thought for you to ponder. Given that mesenteric adenitis is usually viral, self-limiting, what do you think is the single biggest practical challenge for a clinician faced with a child presenting like this? Something to mull over.
Definitely something to think about.
Right. That wraps up our deep dive into mesenteric adenitis using these revision notes. Hope that distillation was useful for you.
And if you are revising for the MSRA, the notes we drew from are available via pasthemsra.com, and there are free resources at freemsra.com too. Might be worth checking out.
Absolutely. Thanks for joining us on the deep dive.